and I'm really excited to be able to introduce Paula. Paula, thank you ever so much for agreeing to join with us today.
No, you're welcome, Matt. Happy to be here.
Paula Sutherland's an experienced HR leader with over 13 years of expertise across diverse sectors, including hospitality, agriculture, and health. She spent the last 5 years at Albury Wodonga Health, AWH, which is Australia's only cross-border health service, where she currently serves as the Director of Health and Safety. Having navigated both the challenges and opportunities that were presented by COVID-19, Paula's played a pivotal role in driving transformation and fostering positive change within the organisation.
Thanks, Matt. Like you said, Albury Wodonga Health is Australia's only cross-border health service, but the complexity from a HR perspective, 28 different EBAs, we're fundamentally a Victorian health service managed by the Victorian Department of Health, but we have sites, including a large hospital in both states. So it makes it incredibly interesting. There have been really good nurses and we've made them managers. Now, it doesn't, obviously as a nurse, you have a certain leadership quality because you're certainly leading the health of your patient, you're leading the shift, you're leading the ward. But perhaps we haven't given in the past our people manager training, because effectively that's what they are. You become less of a clinician and you become more of a people manager, and people managing is really important. We came to this from off the back of a 360 exercise that 178 leaders at Albury Wodonga Health did. There was tough feedback delivered to people, which again is what we hoped for. And from there we could see where the gaps were. The other thing is, you need to always be training for future leaders, because you shouldn't assume that people are always going to stay in their role. So you need to be building future leaders. If you are waiting in health in particular for it not to be busy, that won't happen. So again, what's keeping you busy? How are you addressing? What's the treatment plan for what's keeping you busy? And if that's making sure that people are, head through leadership training to reduce some of that busyness, then that's where I would be prioritizing. Is that nurses are carers, so they'll move straight to caring for people as opposed to managing the person. So it's again, which is where the unclearness comes in, and where I said